Hello, I am Karlene Lawerence. I am the co-director of the interprofessional team on the HRSA Bridge GWEP grant on the geriatric psychiatry service. I am presenting wellness and functional ability in the older adult. As I mentioned before, we have a grant on our service from the HRSA, which I'll define in a little bit, which from the U.S. Department of Health and Human Services to educate the next generation of healthcare providers to be age-friendly and dementia-friendly in an interprofessional format. And we are educating students from all the schools and colleges here at SUNY Downstate Medical Center. And they are rotating on our service to embrace this new format of healthcare for our older adults or community residents. I do not have any conflicts of interest or financial conflicts of interest. As I mentioned before, HRSA is Health Resources and Services Administration. It's a federal department that is a sponsor of our grant. GWEP, Geriatric Workforce Enhancement Program, is the grant that we have received from them to educate the next generation of interprofessional healthcare providers. Bridge has to do with the GWEP grant at Downstate, so our name at Downstate is Brooklyn Initiative to Develop Geriatric Workforce Education. So this is a GWEP grant from HRSA in Brooklyn at SUNY Downstate. CIAD is another grant on our service. It's from New York State, and it's for Alzheimer's care and also to educate the next generation of healthcare providers, students on our service to better assess and take care of patients or community residents with Alzheimer's disease. 4Ms is the format of the grant, the HRSA grant, and I'll explain that later, but it has to do with the 4Ms are what matters, medication, mentation, and mobility. It's a collaboration between the Hartford Foundation and the Institute of Healthcare Improvement. Bridge IT, which I am the co-director of, is the Bridge Interprofessional Teams program. So having the students rotate on our service is Bridge IT, under Bridge IT, Bridge Interprofessional Teams. ADRD, which you may also hear mentioned in this presentation or other presentations that we're also developing, is Alzheimer's disease and related dementias. Bridge GAP is also part of the grant. ECHO is a video learning format that we have incorporated into our grant, bringing our partners, our outside partners, or other healthcare providers that cannot actually come physically to Downstate, and we have interprofessional case presentations, getting feedback from specialists that are not at Downstate that will help us to solve a problem or an issue that we may have identified with one of our patients or community residents. Self-learning module, which is this, it's a curriculum that we are developing for self-learning, and there are multiple different parts of it, different sections of it, and this topic is one of the topics in the Group A. So it's a Bridge self-learning module, Group A, and these are all the modules in the Group A section, and wellness and functional ability is the second one. The learning objectives for this self-learning module: to recognize the impact of integrating the 7 dimensions of wellness on patient outcomes, that define the multiple components influencing the health and wellness of an older adult or community resident. I use those interchangeably. Identify the 8 multidimensional factors of wellness. Provide examples of the 2 key divisions of functional ability, and demonstrate how 3 of the 6 functional assessment screening instruments that I will be presenting could be used in a primary care setting. This is a model for the 4Ms, which I mentioned before, to develop age-friendly, dementia-friendly care. And as you see, the 4Ms are what matters. The M for that is matters. So we have patient-centered, family-centered care. So the goals of the family, the healthcare goals of the family, healthcare goals of the patient is what's important to us, and we incorporate that into our interprofessional team development of healthcare plans for the patient or community resident. Medication, so each of the 4 M's are interrelated and one affects the other 3. So we assess for medication, and that will be over-medication or polypharmacy, because as we I will explain, having too many medications or being required to take too many medications predisposes to having other issues, which is just as bad as not having enough medication or under-prescribing. Mentation, of course, medication, being over-medicated or having to take or remember to take a bunch of medications can affect mentation and mobility, and definitely that could also affect mobility. Mentation can affect mobility, affects what matters to the patient. Mentation affects all the other 3 M's, and as it goes, mobility would affect what matters, medication, and mentation. So they're interrelated and have an effect on each of the other 3 M's. There are ageism alerts, so we are trying to stop ageism, preconceptions of older adults or community residents. We are also trying to decrease stereotypes, so we as healthcare providers need to examine ourselves and become aware of our own biases and stereotypes that we have for an older adult, and we try to eradicate them. So this is just bringing awareness of some, and as you watch other self-learning modules, you'll see different ageism alerts throughout the presentation. So the first ageism alert, ageism is a complex phenomenon with a burden of social and political prejudices with real costs to health, well-being, and longevity of older adults. So this is a reason to stop ageism, is because it affects our health outcomes of our older adults or community residents. So this is wellness. Wellness includes the following multidimensional factors of health that affects overall health. And this wheel, there are different wheels, but I like this wheel because of the color and because it actually explains each aspect of the wellness wheel, is physical, mental, intellectual, emotional, spiritual, social or psychosocial, financial, occupational, and environmental. And you can see this mirrors very closely the objectives of the 4M framework. So physical wellness is not just being free of illness or free of disease. It's care of self for optimum health, being healthy, aging in place in the community, staying in and aging at home for as long as possible, through exercise, nutrition, sleep, and other preventive health measures. So wellness is based on preventive health, preventing an illness before it happens, and there are lots of benefits to preventing preventing an issue before it happens. One is decreased healthcare costs. When an illness is identified later on, more advanced, it takes more healthcare resources, more patient time to identify and to treat, and also the treatment or care factors are higher, may not be curable, may be that advanced that it's not curable, but also just the services that need to go into curing it when it's more advanced. So preventive health wellness is all about preventive health, preventing an illness, preventing a problem, preventing a disease before it happens, when it's more treatable, or never have it happen at all. Mental and intellectual, so interaction through learning, open to new ideas, creativity, critical thinking, problem solving, and seeking new challenges, so keeping our minds healthy. And this is our mentation part of our 4 M's. Emotional, positive attitude, high self-esteem, being in touch with and aware of, accepting of others, ability to constructively express feelings and empathize with others constructively. Spiritual, finding meaning in life events, search for meaning and purpose in human existence, live a life reflecting one's values and beliefs, and demonstrate individual purpose. So spiritual is not having to be a specific religion or a specific religious belief or following a specific doctrine. It has to do with just overall spirituality, being more aware of yourself, what's important to you and how that affects others, your community, your environment around you. And that's also coming up as another of the wellness factors. Social, being connected and interact with others, build personal relationships, deal with conflict appropriately, positively contribute to our communities. So our social or psychosocial wellness affects our overall wellness and most time affects our physical health. So being socially isolated has negative effects on our health, on our well-being, on our functioning. Financial, living within one's means and learn to manage finances in the short and long term. So immediately, you are able to manage your finances, but also planning for long term or later on as you age longer in place in your home. Occupational, seeking an interesting, enjoyable, meaningful career that contributes to the larger community. So being happy at work, less stress at work, enjoying what you do, contributing to your community, and fulfills yourself, fulfills your spirituality, fulfills your healthcare and mental health needs. Environmental, awareness of interactions between the environment, community, and individuals. Awareness of our role to improve rather than destroy the natural environment. You see a lot of reports in the news right now about climate change and the influence of that on our weather, on our where we live, where others live. It's like the wildfires right now in California that are out of control. So that's being aware of that and not contributing to that, actually assisting to prevent that. Responsibility, personal actions to obtain or maintain a healthy physical environment free of hazards. So also throughout the presentations, my presentation, other presentations in the series are what's called brainstorms. So these are little learning opportunities. We pose questions for consideration, something you may not be aware of, something you already know, to think about and come up with an answer. So at this point, you would actually pause the video, do the brainstorm, and then you could continue the video. And throughout this presentation, you could pause the video anywhere as you need to. So health and wellness exams and assessments require an interprofessional healthcare team. Interdisciplinary healthcare staff at either initial or follow-up medical visits or healthcare visits may include what staff specialties. So as I said before, our grant is to foster interprofessional interprofessional format of healthcare for the patient and community residents. On that healthcare team, what other specialties could be there? So if I am a nurse practitioner, so I am on the healthcare team. On our service, we have social work, and on the students that are rotating on our clinical service, we have physician assistants, we have medical students, we have nursing, nurse practitioner students, and eventually we hope to incorporate all the other schools and colleges at downstate to have their students rotate on our service. So when we go out and practice in our professional environment, we will be part of a patient's healthcare team.